James Achai is my name. I am presenting on behalf of a team that I led. I'm glad my dean is here. Professor Toyonjere was part of this team. The work we did was basically capacity building research, or project for that matter. And we had aimed to build capacity in the clinical research and clinical teaching. The department that championed this is the Department of Veterinary Clinical Studies. And the mandate of that department is to teach students to practice veterinary medicine. Like in the medical school, that would be in a ward. And in our case, that should be where the animals are, on people's farms or in people's homes. So our department does not teach in class, is supposed to teach on farms. The approach we were using is that we would sit and wait for the farmers to call us. And indeed, we would sit for like a week with the students waiting for calls, and there would be no call. And to that extent, Mr. Principal, the Dean, and the Chair Grants Management Committee, there was a growing concern that we were graduating students that we have not exposed. And RIF came in quite timely, and we changed our approach through the support that RIF gave us. We decided that let's identify the farms. If a farmer has 10, 20, or 50 animals, and you go to him any day, you will find what to do and what to show the students, such that that student graduates when he's exposed to as much of what he is supposed to learn as possible. So we changed the approach from the clinical approach of waiting for calls to the herd health approach with the support from RIF. Herd health is you visit the farmers on schedule, and we designed it in such a way that every 2 weeks of the 30 farmers that we enrolled into this project, every 2 weeks, we visit that farmer. In a month, we visit that farmer twice, work with him in identifying his problems and working with the available students to design an intervention to identify, rather, to solve the identified problem. Of course, also our infrastructure at the College for Clinical Training was quite wanting. And through RIF, we got support to renovate the infrastructure. And indeed, if you go to especially the small animal clinic at CoVAB, it's quite transformed in terms of how it looks, completely refurbished and rebranded. And then we secured equipment that we didn't have as of now. We have an automated radiographic processor, and we run our radiography in the shortest possible time with improved quality. We are also, for the first time through RIF, doing endoscopy, which we were not doing before. And then ultrasonography, we were not able to scan the abdomen or any other part of the organism that we needed to scan. Through this RIF support, we have been able to do that. Now, on the farms, we noticed, and many of you are dairy farmers or poultry farmers know that with intensive production, unless you control 3 things, you are not productive. You are actually keeping animals as a hobby. So we went on the farms and we made them appreciate that control of mastitis, control of infertility, and control of lameness can so significantly improve their business. And I wish I could, there's a graph there, just to demonstrate what we are able to do through our scheduled visits. Could I have moved down? Move to the graph. There's a linear graph. Yes. This is an illustration of one aspect of what we were able to do. This is when we went to the farms, we found that actually up to 40% of the herds were categorized as having subclinical problem herds, having subclinical mastitis. And many of you who are in production knows that a cow with mastitis is an unproductive cow, as in it will produce little, or if you are selling it to a processor who is concerned with quality, will reject all your milk. And we observe that up to 40% of our farmers in Mukono, Kampala, and Wakiso could be categorized as problem herds, as in they have unacceptable levels of subclinical mastitis. At the first visit, that is when you see one there is when we went in. But by the time we had gone there for the 10th visit, I think that is after about 3 or 4 months, working with them and visiting them every 2 weeks, we were able to bring the level of the problem herds from 40%, we had reached close to 10%. The visits are continuing, and we hope to ultimately support these farmers to reduce mastitis to zero. Mastitis is infection of the udder where milk is produced. So you might imagine a sick breast or a sick udder for that matter would be rendering those animals unproductive. What I've not presented here is to relate the decline in mastitis to milk production. It's in the main report there, and we saw there was a drastic correlation. The figures that was projected there is that nearly all of our farmers are producing less than 10 liters per cow per day. And if you project and include production cost in and factor it in, it's like most of these farmers are running at a loss, especially the dairy intensive production systems, okay? But through our visits, we were able to ensure that some of the farms, okay, particularly because of the reduced incidence of subclinical mastitis and improving the way they utilize supplementary feed, we were able to take some of them to at least 20 liters per cow per day. And we have very wonderful testaments from some of these farmers on how this intervention was timely. But most importantly, being a learner-centered approach, we were not sitting and waiting for a week to respond to one call, okay? This time around, on a daily basis, we were visiting 3 to 4 farms every day, and each and every student, the 70 students or so that could sit without exposure, we were able to each day expose them. What was limiting us was the transport means to take them there. And in our major recommendation to the school is that we change our approach from clinical or case-based approach to a herd health approach where we visit the farmers on schedule, and indeed our students are much more exposed, and all of them, not just a few of them. And that calls for increased support in terms of infrastructure to do that, as in we need transport to be going to these farms on a daily basis and taking much more students than the limited. The transport we're using is a 12-seater, 10-seater actually. So if you put the teachers and the technicians, you can only go with 8 or 7 students. But if we are supported and we are able to go with 15 or so students, I think the exposure is quite good. This is in the policy recommendation that we have put to the school, and we hope that the school through the university will receive this and adequately support for the betterment of the level of exposure we are able to provide to the students. I thank you for listening.